Which of the following advisements should a patient suffering from GERD receive? A. To eat high-protein, low-fat foods. B. To stay upright 2 to 3 hours after a meal. C. Limit the intake of acid-stimulating food and drink. D. All of the above. Answer is D. All of the above. All of the answers are correct. A high-protein, low-fat diet is appropriate for patients with GERD as following this diet helps prevent symptoms of acid reflux. A high-fat diet may delay gastric emptying leading to more acid reflux. Remaining upright will help keep pressure off of the esophageal sphincter and allow the muscle to work appropriately. Limiting the intake of acid-stimulating food and drink will also prevent heartburn by calming the esophageal lining and preventing the esophageal sphincter from weakening. A patient, who weighs 143 pounds, has a prescription for garamicin at 2 mg per kg, IV, every 8 hours. There is 100 mg in 50 ml solution on hand. How much ml of garamicin should the nurse administer with each dose? A. 45. B. 55. C. 65. D. 75. Answer is C. 65. Weight of the patient in kg equals 143 over 2.2 equals 65 kg. Prescription dose of garamicin equals 2 mg per kg 8 hourly. Dose required by patient equals 65 times 2 equals 130 mg. According to the question, 100 mg garamicin is there in 50 ml solution. That is, 1 mg garamicin is there in 50 over 100 ml of solution. If so, 130 mg of garamicin is there in 50 over 100, multiplied by 130 ml solution. Equals 65 ml. A patient is not to eat or drink anything 24 hours before a colonoscopy. A. True. B. False. Answer is B. False. A patient may be instructed to not eat any solid foods up to 24 hours prior to a colonoscopy, however clear liquids are typically allowed until midnight prior to the procedure up to a couple hours prior to the procedure. The nurse will need to verify the orders given by the physician. Which of the following symptoms would a patient exhibit with hyperthyroidism? A. Intolerance to cold. B. Decreased bowel movements. C. Slow heart rate. D. None of the above. Answer is D. None of the above. A patient with hyperthyroidism will present with the opposites of the listed symptoms. Too much thyroxine is produced, causing the body's metabolism to rise. This leads to an intolerance to heat, a decrease in weight gain, increased bowel movements, a rapid heart rate, and warm, clammy skin. A patient is having a tonic-clonic seizure. A nurse should take which of the following steps? A. Put a pillow under the patient's head. B. Put restraints on the patient. C. Use a tongue blade on the patient. D. Lay the patient on his back. Answer is A. Put a pillow under the patient's head. Putting a pillow under the patient's head is an acceptable way to prevent injury to the patient until the seizure has completed.